So there was a patient who I was consulted on who was in the ICU on a ventilator, not getting better. He unfortunately was unvaccinated. His family were not able to be there right away. And it was heart-wrenching because I knew in my heart that I couldn't assure them that he would be alive by the time they got to us. And I'll never forget his wife continuing to say, please, please, doc, just can he hold on? His daughter has traveled a long way and she's expecting and she just wants to be able to see her dad. And I had to give them the grim news that that may or may not be feasible based on where we were. And it was at the tail end of that conversation saying, I wish we'd gotten vaccinated. That was the clincher for me. That was really, really the clincher for me. It was just really hard to hear because at that point, there's nothing more than support that I can offer. I was born in Zimbabwe, in sub-Saharan Africa. My family and friends still live in South Africa and Zimbabwe. And less than 3% of Africans right now have been able to be fully vaccinated. That's compared to over 60% in North America. So it can be so hard to watch us politicize and not understand how fortunate we are to have such efficacious and vaccines, not just one, but 3 available when I have been waiting with bated breath for my sisters to be vaccinated and had to make the decision for my mom to get a vaccine that doesn't have as much clinical data as Pfizer. We're over a year and a half into this. I'm tired, I'm exhausted, as are so many other healthcare workers. Things had started to get better. Dare I say, we started to feel hope again, and then Delta came and everything has changed. I'll tell you that our hospitals are full again in St. Louis and in the Missouri area. To the south of me, we're talking about lack of capacity even. And it's honestly quite triggering for a lot of people in healthcare because we can't believe we're here again. You know, you're at the bedside and people on ventilators are begging you for a vaccine and don't understand that it's too late, or having to have those difficult conversations with family members. That's where we are right now. We're seeing younger and younger people getting sick as well, but overwhelmingly what we're seeing is almost everyone that ends up needing to be on oxygen or decompensating even further to being in an ICU are unvaccinated. I am seeing some breakthrough cases, but those folks are usually, calling me from home or maybe in my clinic because they have long COVID symptoms after quarantine. We're not seeing, at least where I'm at, and this is consistent with what the CDC is telling us, cases of breakthrough infections from people who have been vaccinated in the ICUs. I am tired. I am exhausted. Every day when I leave the house, I have work mom guilt. I have fear about the exposures I could be bringing into my babies who can't even get a vaccine, even if they wanted to. I am worried for my husband, who's also a physician and works in the neonatal intensive care unit, also taking care of sick babies and moms who are delivering early. I worry about my patients. I'm sad to see how ugly we've become and how we've allowed our own personal opinions to trump community. I would never, ever give advice about architecture or engineering because I'm not an expert in those fields. And similarly, it's really hard, really, really hard when I know that a lot of people in this country and around the world take their advice about what they should be doing with their health from people who are not experts. I just don't want to keep seeing people in our hospital beds and in my clinic when it's too late. That is really the only vested interest I have and many of my colleagues have. I'd like to see us just be kinder to each other because we still have a long road ahead and we're not going to get through this without taking care of each other.